The next question is from Ryan from Brooklyn. And Ryan asks, I had my prostate removed 3 years ago. My PSA was always 0. Recently, my PSA started to climb up. Should I worry, and what do you recommend?
So this is actually a very important question that I see this even in my own practice, that when you have done surgery, you have removed the entire prostate.
Right.
And then the patient, comes back a year or two after and goes, doctor, why am I following up? You already removed my prostate, or why are you checking my PSA? It's an interesting question. It makes sense. But what you need to know is that even if you have removed your entire prostate or prostatectomy, your cancer may come back. Right. And if you look at the diagrams that we have, after radical prostatectomy, your PSA should always be 0. So you can see the curve is going to go all the way to the level, and it should be undetectable or 0. And as long as your PSA is 0, you're cured. There are times that you may have a very aggressive cancer. You may have a Gleason 8 or 9 or 10. Or you may have what we call a seminal vesicle invasion, or it could be a T3 disease. In those cases, there's some likelihood that the cancer may come back, or you may have cancer in your lymph nodes.
Right.
On those patients, we always examine you. You need PSA follow-up. And if your PSA reaches 0.2 or so, that's when we start thinking about perhaps there's recurrence. You may need some form of radiation. Now, what's interesting, Cynara, is that a lot of people also may or may not know this, but you can give a low-dose radiation after surgery. But once you go for all these cyber knives and all these radiations of the world, right, if the cancer comes back, surgery would be extremely difficult and challenging.
Right.
So surgery after radiation is hard, but radiation after surgery is feasible. It's a low-dose radiation, works really well. So my answer to, I think, Alex or Ryan was, make sure you follow up your PSA, make sure you get a second opinion, and if your PSA is coming back up, then we need to treat it.
My dad had prostate cancer back in the 1990s, and
I didn't know that, actually.
Yeah, so he had I think he was relatively early stage, relatively early grade, but he ended up having a radical prostatectomy. And so for years afterwards, he would get his PSAs checked, and he would see increases in his PSAs. Of course, he'd get very anxious about what that all meant. But you can see fluctuations with up and down, right, with the PSAs going up and down. Does that mean anything when they're going up and down?
Well, when people talk about the fluctuation of PSAs, mostly happens when they have their prostate. And that's not when they have prostate cancer. So typically, you may see an uprise or lower and down. Number one, anytime you get your PSA, make sure there's no sexual activity for 24 to 48 hours before getting that test, because that's one of the things that can actually increase the level of PSA. Right. But inflammation of the prostate, enlarged prostate, or depending on any kind of trauma, or that PSA can go up. Now, after surgery, if you've removed the entire prostate, PSA should be 0. So in your case, of your dad's case, if the PSA is climbing up, we need to see him. We need to make sure that we get a bone scan and get a CAT scan, restage him, and find out if there's any cancer outside, and then treat it very aggressively. And they end up doing very well. Okay. Depending also what kind of cancer he had. So,
can a rectal exam cause an increase in a PSA when you've had your prostate removed?
It's a good question. No, after it's removed, it should not cause any increase of PSA.
Okay.
Some people talk about, should I get my PSA right after the doctor did the exam? And unless they do a very aggressive prostate exam, it should not really cause the rise. So I wouldn't worry about it. And that's $25 copay for your dad and all the consultation.
I'll be sending him in to you.
All right, let's go to the next question.